In the health sector, Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, has disclosed the federal government is working to unify the country's public health system and address the funding gap. This, according to the minister, is part of the proactive efforts to secure essential medical supplies for millions of citizens affected by HIV/AIDS, tuberculosis, and malaria, particularly in light of recent global shifts in public health policy. While speaking at the inaugural meeting of AIDS, Tuberculosis and Malaria Technical Working Group in Abuja, Professor Pate emphasized the importance of integrating sector-wide approaches in efforts to improve healthcare delivery, ensuring a seamless transition and sustainability across health subsectors.
The sector-wide program, the sector-wide policy and hope offered some opportunities for managing the transition as a consequence of the new U.S. government's policy on development assistance, and agreed that a technical working group under the SWAP governance that addresses HIV, TB, and malaria, which had previously been treated as standalone because many of the funders of those programs were already committed outside government systems, so they were not brought in. But with the policy change, that we needed to make that adjustment and create a working group. And that working group, consistent with the approach with other working groups under the sector-wide policy, we have co-chairs and members. And the Secretariat of SWAP helps to coordinate that as a secretariat, but the working group is co-led by members, and it's a multi-stakeholder group that looks at issues and brings them to us.
Professor Pate also pointed out that President Bola Tinubu's establishment of a cabinet committee, which includes Ministries of Health, Finance, Budget and Defense, as well as the Nigerian Governors Forum, aims to explore and secure funding solutions for critical health interventions.
And in this instance, we proposed that the DG NACA and the Director of Public Health in the ministry co-lead the technical working group that is looking at HIV, TB, and malaria. So that it's not just HIV alone, it's not malaria alone, it's also not TB alone. And that it includes NASCAP, it includes MPHCDA from primary healthcare for the elements that are linked to that. It includes NCDC, it includes malaria program, it includes the TB program, and it also includes NHIA from the market shaping, that's the federal government side.